Good evening, everyone. This is Dr. Kishore here, practicing pediatric endocrinologist and diabetologist, KIMS Cuddles, Hyderabad. Works both in Secunderabad, Kondapur, and even in Gachibowli also. Uh, November 14th is a World Diabetes Day. We are celebrating World Diabetes Day on birthday of Sir Frederick Banting. So diabetes is globally, it is a challenging problem to the entire population. Incidence is increasing rapidly, especially post COVID. Almost 5 to 10% of all diagnosed cases like contribute almost into the type 1 diabetes. So type 1 diabetes is one of the most common chronic problem in children, and it affects less than 1 year to any age group, but still it is more common in children. Adults can do get type 1 diabetes. So, on the occasion of World Diabetes Day, today I want to talk on type 1 diabetes in children, challenges faced by parents, what are the dietary management options, importance of sugar testing, insulin therapeutic option, how to titrate it, how to administer, what are the comorbidity and complications because of improperly and poorly managed diabetes. So first of all, type 1 diabetes, like everybody, like everything is shock to the parents. So everybody think that diabetes is a disease of old individuals, but it's a myth. Like how an adult will have like a good, bad, grief and happiness, children they do have all those kind of feelings. So similarly, whatever the disease are there in adult, so majority children do get those kind of chronic disease. So that indicating that children can also have diabetes, but the most common variety of diabetes in children is type 1, whereas adult more common type of diabetes type 2. So in type 2 diabetes, the problem is insulin action. Insulin will be there, but the power of insulin will be low. Action of insulin is weak because of low power insulin resistance. Sugar is not getting utilized. Because of that, they do get diabetes. We call it as a type 2 diabetes. Whereas in children, diabetes is because of inadequate or ineffective insulin production. So lack of insulin will make the sugar to get elevated. So elevated sugar will cause a diabetes in children. We call it as a type 1 diabetes. So what are the symptoms of type 1 diabetes? So usually there are 4 T's of type 1 diabetes. One T for thirsty, second T for tiredness, third T for thinning, fourth T is toilet. So the children with type 1 diabetes, they drink more water. So the thirstness will be increased more. So and simultaneously there will be increased urination. So toilet will be increased. So roughly less than 5-year children, they need to drink 500 ml to 1 liter of water, and around 10 years they need to drink 1 to 1.5 liter of water, and more than 12 to 15 years they need to drink up to 1.5 to 2 liters of the children. So any children who is drinking more than the specified drink, we should call it as they're drinking and asking for the more water. So similarly they do pass more urine. Third will be more tiredness, and fourth there will be unexplained weight loss. So usually the weight gain is a continuous process. So as the days progresses, as the child increases in age, there should be constant and persistent weight gain. If there is no weight gain, and if the children are losing more weight, we should think of underlying diabetes. So not only 4 T's, there will be more recurrent infection, especially skin genital infection, oral infection, deep infections are more common. So these are the, and when there is a complications because of the diabetes like ketosis and acidosis, they do get like associated symptoms like vomiting, abdominal pain, headache, difficulty in breathing, and they become drowsy, and they may not able to sleep, and they do have a abnormal breathing. That means they may take breathing very fast and very deeply. So we call it as acidotic or kusumal breathing. So these are the usually symptoms of type 1 diabetes. But how to predict these type 1 diabetes? So the predictors of diabetes is any significant history of symptoms and also associated autoimmune problems like celiac disease, like it is a GIT problem, like there is a like child will have more increased stool frequency, and also skin problems like autoimmune psoriasis and associated autoimmune lichen planus, and also having more than two autoimmune problems. Sometimes autoimmune thyroid disease children are also have more association of type 1 diabetes. So when there is a associated autoimmune problem, we should think if any child presented with the symptoms, child is more prone to develop type 1 diabetes. And any at risk sibling, any family history of diabetes, okay, and any children like who underwent like pancreatic related surgeries, pancreatectomy, and any children with diabetes and syndromes, they are more prone to develop diabetes. So can we prevent diabetes? So unfortunately we can't prevent a diabetes, but we can modify the disease progression. Say at risk children are there, so early pickup, screening, and proper diet and physical activity addressing to the children, so we may prolong the presentation of type 1 diabetes. So type 1 diabetes can't be prevented. So and I want to address to the parents that so it is like an accident. So by knowing early, we can just modify the disease progression, or we can reduce the disease burden, but we can't prevent it, or we can't 100% stop the progressing into the complicated diabetes. So at certain point of time they do manifest. So and another strategy is how to prevent development of type 1 diabetes is, so try to like continue exclusive breastfeeding and try to encourage mother to have a more normal deliveries. So the children who are born by LSES, the children who are on formula feeds early, the children who are exposed to the more cow milk or any egg protein or fish protein, and the children these kind of the children, they are more prone to develop type 1 diabetes. So we can minimize if we encourage more normal deliveries, and we encourage to continue like longer period breastfeedings. So once you suspected, then how to diagnose this? So only 10% of the diabetes they presented in the critical conditions. Okay, so 50% will be diagnosed in DKA condition, diabetic ketoacidosis. So 50% of the diabetes children they diagnosed incidentally. Child would have developed only fever, so they went to doctor. So just casually, doctor checked the sugar and they found that there was a elevated sugar. And child had some urine problem, so they underwent urine examination. So in urine, doctor noted that there were like passing sugar in the urine. So 50% of the diabetes was missed. So that's the reason I want to tell all the parents and also to the participating doctors. So sugar should be considered as a sixth vital sign. So in medical practice, we call four vital signs like temperature, pulse rate, respiratory, BP. So oxygen saturation we call as a fifth vital sign, and checking sugar whenever you are addressing in OPD or IP, make it as a important parameters. It should be addressed by both the doctors, and also parents should be aware of checking sugars. So when the sugar is abnormal, then doctor should do needed investigation. So when to call diabetes? So there are no different cutoff to diagnose diabetes in respect to the age. Even like a live born baby, 1 year child, 5 year child, 10 year child, are old individuals, male or female. So irrespective of the age group, for all individual, the cutoff to diagnose diabetes is same. So any individual whose fasting sugar is more than 125 and postprandial, that means after having food, major meals, So okay, after 2 hours of taking meals, if any random blood sugar is more than 200, we call it as diabetes. So how to confirm it? So frequent serial checking of sugars. So with the separation of 24 hours, at any more than 24 hours of duration gap, sugar is diagnosed to be more than 125 fasting, more than 200 random or postprandial sugar, HbA1c cutoff more than 6.5, we call it as a diabetes. So diabetes is a both clinical and biochemical diagnosis. When there are symptoms of diabetes and when the blood test was detected abnormal blood sugar, we call it as a type 1 diabetes. So majority of the parents will ask, yes sir, so my child is having diabetes. How it is different from adults? See, like in type 2 diabetes, pancreas is actively normal, beta cells number is normal. Maybe in later stage, beta cell number may be low, but during early presentation of diabetes, beta cell number is normal and function may be more. So insulin level will be more, whereas insulin resistance will be there. Whereas children with diabetes, we call it as a juvenile type 1 insulin dependent diabetes. In this situation, because of autoimmune process, maybe because of idiopathic genetic and environmental factors, there will be constant progressive regression decline of beta cells. So because of decreased beta cell, insulin production will come down. So as beta cells are not there, as there is no insulin production, so there will be abnormal sugar control that leads to diabetes. So whereas in type 2, there are multiple options to treat it, like giving medicine, like English medicine, tablets, Ayurvedic, homeopathy, Unani, diet, physical activity. So all they act at the improving the insulin power. So once insulin power is improved, definitely sugar will be controlled. Whereas in type 1 diabetes, the main important reason for the developing diabetes is because of lack of insulin. Unless otherwise you are not going to replace insulin, diabetes will not be controlled. So at this point, I want to tell everybody that type 1 diabetes is a progressive sugar disorder. There is no permanent cure, there is no reversibility. It may be halted, the disease severity may be decreased, may be controlled. But type 1 diabetes, if the diagnosis is sure it is because of the insulin deficiency, it will be permanent, lifelong, and other than replacing insulin, no option is there. So insulin is not going to treat diabetes, it is not going to control diabetes, it is only going to make the carbohydrate, it is going to use the sugar glucose to be utilized in the production of energy. So it is going to reduces the sugar burden to the body. So insulin is a one of the good and best weapon to control the sugar level. So by taking insulin, diabetes will be under control, but diabetes will not be cured. Okay. So once the diagnosis is confirmed, so if the child is like stable, we can start on subcutaneous insulin. If the child is sick, so need a hospital admission, oral intake is poor, or maybe because of the elevated sugar, child was presented in complicated status, child may require IV fluids and IV insulin. So insulin administration may be through the skin or maybe into the vein, blood vessel. So if we gave insulin into the vein, we call it as a IV insulin. If we administer insulin into the subcutaneous, we call it as a subcutaneous insulin. If the child is stable, so the treating physician or doctor or diabetologist will decide should we start or initiate insulin either subcutaneous or IV insulin. Okay. So there are no other alternate option, and majority of the times parents maybe in denial like a stage when we diagnose and inform the status of the diabetes and about the permanence need of insulin injections, permanent frequent sugar testing. So they may defer to give insulin, but to save the baby, to salvage the baby, to prevent from complications, so insulin is the only option. So I would like to thank Banting for discovering the insulin. So before 1921, once type 1 diagnosis is confirmed, dying bed is the only solution. Survival rate was zero. Means all type 1 diabetes children they used to die. because of lack of available treatment. But from last century, more than century, because of availability of the insulin, the lifespan, quality is increased to such a way that all type 1 children who are having good diet control, proper sugar testing, proper insulin administration with good lifestyle, they are leading life like a normal individuals. So they may lead life like us. And majority of the parents, they are also having a problem and think that it is like a handicap. So I want to tell that it is not like a handicap, and it is not like a chronic neurological, cardiac or kidney problem. It is only because of insulin replacement. If you are properly replacing and adjusting the insulin with proper sugar monitoring and diet, they will lead normal life. They can continue marital life, they can have children. So their life, they will be normal as like normal individuals. So coming to the treatment of diabetes, so insulin, diet, sugar testing, and exercise. These are like four pillars of a stool. So nothing will have a superiority or a priority. All are having its own importance. Okay. So diet should be controlled, and we should do exercise, and we have to test the sugar, and we supposed to give insulin appropriately. See, in type 1 diabetes children, the sugar problem is elevated sugar in the blood. So the sugar in the blood comes from the two sources. One source is from the diet, and second source is from the internal like production of sugar from a process called gluconeogenesis by using substrates like protein, fat, and some kind of hormones and enzymes. They produce glucose. 30 to 40% of the sugar into the blood will come from metabolic process from the organs and hormones, whereas 50 to 60% of the sugar will come from food. So that is the reason, if you're not able to control and follow the proper dietary management, diabetes may not achieve adequate control. So that is the reason it is important. In later session, maybe after 10 to 20 minutes later, I will specifically talk about the diet. So but I want to highlight here that diet is much important. Second thing is, checking sugar is important. Majority of the parents will deny and tell that, sir, my child want to go to school, so we can't go and check this child always, so we don't want to check sugar in the school. And child is complaining pain, so we are not able to see her pain, his pain, so we don't want to check sugar. And sir, everyday sugar is coming same like 120, 150, 200. So that as the sugar is normal and coming everyday normal, we are not going to take any therapeutic decisions. We don't want to check sugar. Sir, we are financially poor, we don't have any money, so we are not able to buy strips, we don't have any glucometer. That's the reason we don't want to check sugar. So to speak frankly, checking sugar is like a following a signal. So whenever you want to cross a signal, you have to watch the signal, observe the signal. So if you observe the signal, then only you came to know that whether the signal is in yellow light, red light, and a green light. Because depending on the type of light which was showed by traffic signal, you will take a decision. If it is yellow, you will wait and watch. If it is green, you will move on. If it is red, you will stop. So similarly, checking sugar is like a traffic signal. So 90 to 95% of the diabetes children, when the sugar is elevated, when the sugar is low, the symptoms may not manifest. So the only way of checking the level of sugar is by SMBG. We call it as a self-monitoring blood glucose. So we need to check sugar. So as per the protocol, we need to check sugar 6 to 7 times a day: before breakfast, after breakfast, before lunch, after lunch, before dinner, after dinner, and midnight. This is the protocol. So ideally, we need to check before meals, and after taking insulin and meal, we need to know whether we achieve the euglycemic episode or not. So to confirm that, we need to check 6 to 7 times. But as we are doing intermittently, at least as per the ISPAT protocol, NICE guideline, EDA, we call it as the American Diabetes Association guidelines, we need to check sugars 4 times a day. For the type 2 diabetes, at least 4 times in a week. Whereas for the type 1 children, we need to check 4 times in a day, at least before breakfast, before lunch, before dinner, and midnight. There are no shortcuts, There are no excuse. They need to check sugar. If they are not checking sugar means they are taking risk. So 90 to 99% may not happen anything, but once or few times the child may landed up in critical and risk stage. So we lost so many children who went into low sugars, throwing fits, went into coma, high sugar, DKA and organ damage presented in like non-treatable conditions. So that is the reason my sincere advice to the all parents and all caretakers, don't take any chance. So whenever there is a possibility, please convince the child, convince yourself, try to check sugar as much as many as times as possible. So without checking sugar is like crossing the road without seeing the moving traffic. Please don't take any risk. Try to check sugars as much as possible. And third thing is insulin. So insulin is more important. So we need to give insulin 3 or 4 times a day. As per the ISPAD guidelines, pre-mixed insulin is not advisable, and rather than beneficial, they are more detrimental and more harmful to the children. So because of the pre-mixed insulin, we may not achieve euglycemia, the target HbA1c may not be achieved appropriately, and child may land up in recurrent hypoglycemias, may have high glycemic variability. So because of which, like chronic complications like macrovascular complications like retinopathy, nephropathy, neuropathy, cardiomyopathy are more common in premixed insulin. So that is the reason, as per the latest guidelines, premixed insulin are not advisable to all children less than 16 to 18 years. And majority of these individuals after 10, 11, they think that they are almost like adult, and they will frequently shift to two insulin regime, nothing but pre-mixed insulin regime. So it is advisable for the adults, but whereas in children with type 1 diabetes especially, it is not recommendable, and it is not at all advisable for children. Okay, so they need to get at least 3 or 4 injections. So usually there are 5 types of insulin. So now, like just for the ease of convenience and time being, I want to talk about the only 2 types of insulin. One is long acting insulin, and second is short or rapid acting insulin. We give long acting insulin at bedtime, or we can give morning also. Whereas a rapid or short acting insulin, we call it as a pre-meal insulin, before breakfast, before lunch, before dinner, 3 times, and sometimes evening snacks also we need to give insulin. So the pre-meal insulin, rapid or short-acting insulin, the purpose of giving is we want to cover the sugars which are enter into the body by eating or consuming the food. We have breakfast, we will have lunch and dinner. So by eating food, sugar will be elevated. To control that, we need to give pre-meal or rapid or short-acting insulin. Whereas endogenous sugar production will be there, and intermittently also because of the stress, infection, hormones like growth hormone, catecholamine, sex hormones, they also need energy. They may also elevate sugar. So for those kind of sugars control, so long acting insulin will be helpful. So both the type of insulin they need to take it. So rapid acting will be pre-meal, and long acting insulin will be bedtime. So, and majority of the parents, they will ask, sir, my child is going to school, I want to skip the insulin in the afternoon. So the important point parents need to understand is whatever they are eating, so it should undergo digestion, absorption, and ultimately get into energy production. If you are making the child to eat without insulin, it is not going to be utilized, because energy, glucose, carbohydrate, for the production of energy, carbohydrate and glucose are the substrates. Once they are digested, metabolized, and they will releases the energy. So for the conversion of glucose to energy production, insulin is essential. If you are making the child eating without giving insulin, is like giving food which is not at all useful production of the energy. So it will not help for the energy production, it will not help the child to increase weight and height and also growth. So eating food without insulin is like giving more ketones, more fats, more glucose into the body, which are more harmful to the child. So the number of times should be equal to the number of injections. So the only option for not giving insulin is not giving food at the lunch time. If child is not eating lunch, you can skip the insulin. If child is eating lunch or evening snacks, he need to take insulin. It is a must. It is a compulsion. There is no excuse. There is no exception. There are no shortcuts. Okay. So lunch also we need to give insulin. So without giving insulin, taking food is a poisonous, it is harmful to the children with diabetes, so they need to take insulin. And another thing is fourth, so by doing diet, by checking sugars, titrating insulin, we may achieve only 60 to 70% of the euglycemia. Because of some reasons, because of internal sugar production, because of sedentary lifestyle, because of unmonitored sugar intake, and unnoticed sugar elevation, so that should be come down. So exercise will make the elevated sugar to utilize, and simultaneously by encouraging physical activity make the insulin to become more powerful, so that less insulin do more work with the help of physical activity. So they do more physical activity, less insulin will be required. If they are not doing any physical activity, more insulin will be given. So the more the insulin, lipogenicity, excess weight gain, and a few minor insulin side effects will be more seen. So that's the reason with lesser drugs, if you want to control good sugar control, you need to be physically active, you need to do exercise. So at least 30 to 45 minutes in a day, 5 days in a week, we should encourage the children to go for the exercise. So whenever child want to do contact sports, long term activity, so it is recommended to check the sugar. The ideal sugar level should be 100 to 250 before performing physical activity. So type 1 diabetes should not be a challenge. It should not minimize the effectiveness of the physical activity or performance of the child. So sky should be the limit. So that's the reason we always encourage the child to do all sorts of physical activity. Only few physical activities like swimming, like unmonitored adventurous trips, unmonitored road trips should not be like encouraged for the children. So if under the monitoring of the healthcare provider, we can encourage them to do even those kind of swimming, cycling, and adventurous trekking and tripping also can be done. Okay, so this is how. Assume that you are doing this, but unfortunately because of some reasons, some children they are not following the doctor's commands. So what will happen if we are not treating diabetes? Even if we are treating diabetes, we are not completely controlling it. We are addressing the diabetes only partially controlling, partially treating. So there will be long term side effects and complications. So what are the long term complications because of improper diabetes control? Is there are short term complications and long term complications. So short term complications will be like, say for example, sugar is elevated, it is not getting utilized for the energy production. So the elevated sugar will be converted into acids and ketones. When there are elevated acid and ketones, we call it condition as a DKA, diabetes ketosis acidosis. So ketones are and acids are more dangerous and more disastrous than sugars in complicating and damaging the organs. So when ketones or acids are elevated, they will get deposited in the lungs, kidney, brain, eyes, and they will start damaging. Okay, so DK is one of the short-term complications. When the child is in DK, they presented in severe dehydration, abnormality in electrolytes. We have some electrolytes called sodium, potassium, chloride, magnesium, calcium. So these electrolytes will get disturbed. So when they get disturbed, they will damage organs. And when there is a decay also, they are more prone for infection. There will be associated colon infection. So child will be landed up in very sick and critical condition. Sometimes by giving only insulin may not able to make them better. So may require additional treatment, ventilation, cardiac support, and organ protecting specific therapy we need to give. Okay, that to prevent that, so sugar should be controlled. And other short term complications are like poor weight gain, poor height gain, and poor immunity, They're more prone for recurrent infection, and also developmental problems, behavioral issues will be there if you are not properly able to control. Because of the proper control, they may not able to concentrate well, so the memory will be compromised and school absenteeism will be there, so that the performance of the child will be hampered. These are the short term complications. What are the long term complications of the diabetes? So elevated sugar is like a traffic jam. More the sugar, more the traffic jam. So more the traffic jam, you may not able to reach the destination in adequate time. Say for example, you need to go to office at 9 o'clock. Because of the traffic jam, you're not able to reach at 10 o'clock. Obviously your performance will come down, and company performance also obviously come down. Similarly, if the more the sugar will be traffic jammed, and especially small blood vessels will be traffic jammed, they will be blocked. So because of small vessel blocking, so especially these small vessels do exist in eyes, kidney, skin. Okay, they are affected very early. So that leads to permanent eye damage. We call it as a diabetic retinopathy. If the kidneys are damaged, we call it as a diabetic nephropathy. If the blood vessels of the skin or nerves are involved, we call it as a diabetic neuropathy. So once they get damaged, we call it will be permanent, irreversible, lifelong. So just after establishing these complications, even if you control the sugars, so there will be no remission, there is no improvement. It is like a damaged car. Once accident done, even whatever repair you do, it may not be like a first hand car, it will be always like a repaired car, like that. So whatever sugar you will try to control it, once organs get damaged, it will not get improved. And another thing is morbidity and mortality, long term complications. So by these long term complications, the quality of life will be compromised. Child will require frequent hospital admissions, frequent healthcare professional visits, frequent testing, and therapy cost will be increased. So that morbidity, quality of life will be compromised. And even because of this bad diabetes control, the quality of life will be compromised, the lifespan will be compromised. So the best thing is, do check sugar frequently, follow the diet, encourage the child to have exercise, do proper insulin titration. So by doing these four major important actions, your HbA1c should be controlled in a normal, less than 6.5 to 7, so that micro and macrovascular complication will be minimized, quality of life will be improved, lifespan will be maintained, so that they will have a good and healthy life. Okay, so this is the funda of managing diabetes. So how to monitor the diabetes is, for the patient point of view, they need to check sugar daily, at least 4 times a day, if possible 6 to 7 times a day. So there are different options of sugar monitoring. Okay, how to monitor sugar is, so in ancient days we need to monitor sugar by only lab sugar test, but now point of care glucometers are available. Now most advanced is, there are sensors. By just applying, and sensor will test sugar every 5 minutes. So the only like available sensors in India are Libre and Libro Pro sensor. So like, they are quite economical, and for middle and low middle class family they are not reachable, whereas for the upper and above middle class family, yes, as a standard of care they can use sensor for the sugar monitoring. And from the healthcare provider aspect, how to monitor diabetes is, like every 3 monthly we need to do HbA1c. So HbA1c is like glycated hemoglobin. So in blood there is a hemoglobin and also sugar. The more long standing sugar, the more the binding capacity of sugar with the hemoglobin. So the more glycated hemoglobin will be elevated. So it will give over last 100 to 120 days of average sugar level. So ideal non-diabetic HbA1c should be less than 5.5. In pre-diabetes, 5.5 to 6.7. More than 6.7, we call it as a diabetes. So at least as per the NICE guidelines, European guidelines, HbA1c should be around 6.5, whereas as per the ISPAD 7, American Diabetes Association guidelines, the target should be 7.5. So in my practice, I feel 7 is ideal, 7 to 8 is acceptable, more than 8 is not at all acceptable. in my like view, 8.1 and HbA1c 15 will not have any major difference. The because some children they do start developing micro and macrovascular complication at the HbA1c of 8.1, and some children may start developing HbA1c when more than 13 and 15. So we can't predict which children will are more prone to develop micro and macrovascular complications early and late. So that's the reason for the monitoring purpose, HbA1c 8.1 and 13, there will be no major difference. All parents and healthcare provider, it's a sincere advice is that please make sure that your child will obtain HbA1c around 6.5 to 7, so that the quality of life and lifespan will be as normal as like a normal individuals. So this is how we monitor sugar. Coming back to the diet. So parents will ask, sir, my child have diabetes. I want a diet chart. Okay, so we can't advise the individual, I am eating two chapatis, two idlis, one java, something like that, to eat all other children same, because children's school timings, actions, growth, development, they are dynamic, they are always should be a progressive. So that is the reason there is no specific diet chart for type 1 diabetes, unlike in type 2 diabetes. But the take home message related to diet in management of type 1 diabetes is, so whenever like there should be at least 4 meals or 5 meals is also acceptable. At least three should be major meal, two should be minor meal. So major meal, if it is a growing and young child, it may be unlimited, whereas a older individuals, once growth and development is completed, can the diet will be limited. Okay, so unlimited breakfast, lunch and dinner, and moderate amount of carbohydrate, moderate amount of protein, moderate amount of fat, and high fiber diet. Whereas in between two snacks, minor meals should have a low carbohydrate, protein rich snack should be there. So breakfast, snack, lunch, snack, dinner. So these are the advisable diet intake for the children with type 1 diabetes. So whenever child needs to prepare a diet, they should have an understanding that every food will have a some glycemic index. To my knowledge, all the diet which are consumable, which the child is eating and palatable, are sugar containing diet. There are no zero sugar free palatable eatable diet. Even though non-veg which are protein rich, they do contain some amount of carbohydrate, and because of gluconeogenesis process, protein may be converted to carbohydrate. So that is the reason, in my point of view, even meat, even though we call it as a zero carbohydrate diet, but it is not a zero sugar diet, it will produce some amount of sugar in the blood. So that is the reason I want to tell that, so diet should containing low glycemic index. So the food which are rich in low glycemic index, the food which are having more complex food, complex sugar, the rich in carbohydrate and associated fat should be encouraged for the children. The food which is more rich in carbohydrate, simple, refined, easily taste, sweet, palatable diet should be avoided or should be reduced. So whenever you want to give high glycemic index, low glycemic index and high glycemic index food should be mixed, so that the high glycemic index food glycemic value will come down and sugar will not go undergo excursion. So sugar will not be elevated. So sugar will be controlled. So breakfast, lunch, dinner should be unlimited. Okay, so only which should be avoided is the food which are rich in maida, the food which are rich made with basin, food which are made with sugar, jaggery, jam, junk, cool drink, juices, beverages, ice creams. These should be minimized or avoided. Okay, there are certain fruits which should be restricted. So just some parents are may getting confused. So I want to divide the food into groups: cereals, pulses, vegetables, okay, non-veg dairy products, and fruits. Coming to the cereals, highest amount of glycemic index is available in the rice. If there are no alternate options to the rice. So whenever you want to make the child to eat rice, choose brown rice, single polished, mota rice. We call it as a thick rice. Okay, so that will deliver less amount of the sugars. And it is, but among the cereal, this is the highest amount of the sugar containing cereal, followed by wheat, followed by like jowar, maize, and followed by millet. So millets containing low amount of the sugar, but it should be take home message for the parents that only millet based should diet should not be given, because whenever we should give a diet to the child, it should have a complete full plate, complete meal. The balanced meal means adequate amount of 40 to 50% of the carbohydrate, 20% of the protein, 20% of the fat, 5 grams of fiber, and less than 2 to 5 grams of salt should be there in the balanced diet. To meet the balanced diet, if we advise only millets, and if you are completely stopping rice, so you may miss or minimizing the child to expose balanced minerals and vitamins. So in my practice, I will never say to any type 1 child to completely stop rice. They can eat rice, okay, but they should know what is the glycemic index of the rice, how much insulin should be given according to the food intake. So rice can be eaten by the type 1 diabetes. Coming to the pulses, all pulses are edible. They can be eaten in unlimited quantity. But only thing is roasted chanas and roasted peanuts. So by doing roast, those unsaturated fats will convert it to saturated fats, and saturated for fats, because of the gluconeogenesis process, they will produce more sugars. So though they may elevate sugars, so just only advice is roasted peanut, roasted chanas. It is better to advise, whereas all pulses can be eaten by the type 1 diabetes. So coming to the vegetables, only like aloo, aravi, sweet potato, pumpkin. So these are the fruits which vegetables which are a little bit of moderate to high glycemic index. It is better to be avoided. Whereas other vegetables can be eaten. Okay, so better and advice is half boiled or para cooked vegetable, or like raw vegetable eating is much advisable for the children. So this is about the vegetables. And coming to the non-veg, so boiled cooked meat can be eaten, but only advisable advising thinking is roasted, marinated, like added with more masala meat should be avoided. Unfortunately, in India, in cities like Hyderabad, we eat more masalas, more fries, and more marinated chicken and non-veg mutton. So these should be avoided. And seafood they can eat like fish, prawns, crab. If they are cooked, they are very good, but better to avoid like frozen and frosted fried non-veg items. Coming to the dairy products, all dairy products are edible and consumable. Even they can eat ghee also, curd also, milk, and chanch buttermilk also. Coming to the fruits, the avoidable fruits are the fruits which are containing high glycemic index are banana, mango, watermelon, chiku, sapota, and green apple, green grapes, white grapes, and black grapes, sitafal, pineapple, jackfruit, strawberries. These are the fruits which are containing high glycemic index. So it is better to be avoided or reduced, or whenever advised to, like want to take it, they should take it in a moderate or minimal amount. Whereas the fruits which are containing moderate to low glycemic index are like oranges, mosambis, apple, green guavas, papayas, kiwi fruit, dragon fruit, and pear fruit, like berries, so dry fruits. So these are the fruits which are containing low and medium glycemic index. So they can eat on protein basis. Coming to the processed foods like biscuits, pizzas, burgers, chocolates, ice creams, it's better to avoid it. If the child want to eat biscuits, biscuits made with wheat, ragi, oats are advisable. Okay, so biscuits which are made with maida are not advisable. Coming to the sugar free biscuits, sugar free chocolates, sugar free ice creams, and sugar free tablets, so there are no recommended guidelines, but till now off label, especially adolescent children who are more than 10 years, they are taking off label. There are no proven side effects, and we don't know the safety profile, but On long term basis, taking larger quantities is definitely not advisable. Okay, because once they used to taste the more sweetness, always they expect more sweet in their food consumption. So that is the reason it's better to keep all the food at the same taste level. Adding sugar, added sugar, it is better to limit or minimize the quantity so that the diabetes will be well controlled. So with this, whatever the education and information I could able to provide about the type 1 diabetes, so I able to deliver on this live platform. If any questions are there, I'm ready to ask. I'm ready to give answers to them. Yeah, doctor, can childhood diabetes be cured or prevented? Uh, at the beginning of my present itself, I told if it is a type 1 diabetes, at this moment, there is no cure. It is a permanent, progressive, lifelong insulin dependent type 1 diabetes. Coming to the prevention, in future, yes, there are many studies, many trials are telling that we may prevent it. So there is a recently launched drug. The name of the drug is teplizumab. It is a monoclonal antibody. It is a T4 cell modulator, because everybody knows type 1 diabetes is a autoimmune diabetes. So there are autoimmune or auto triggered cells which will go and destruct the beta cells. So if you prevent the destruction by own cells, we may prevent it. So there are trials like Oxford, Stanford studies. They are for the twin siblings. Say for example, twins are having, one child is having type 1 diabetes and second is at risk, and antibodies are positive. For the second twin, by giving these drug, we can prevent the secondary and tertiary progression, but we can't 100% prevent the progression of the type 1. Only we will minimize the presentation of symptoms. So we 100% we can't prevent it, but to some extent we may reduce the progression by modifying the disease. And also early screening, early checking, and in early stage diet control, we can prevent the complication secondary to diabetes, but we can't prevent the diabetes. So next question. Is it safe to use continuous glucose monitor? So in Western countries, CGMS, real-time CGMS usage is standard of care. So it is definitely safe, but there is a discrepancy of the accuracy of the sugar level. So always the most accurate sugar level is blood sugar, followed by SMBG glucometer, self-monitoring blood glucose, followed by CGMS. So rather than single value, CGMS will tell about the trend of the sugar level. So assume that base level is, actual sugar level is 100, but CGM is showing 120. We are not worried about the 120. We are worried about the rise of sugar, effect of the food, effect of insulin. So we want to know the trend. We want, not only we want to maintain the sugar at the normal level, but during the progression of the day also, sugar should go in a normal range. So to monitor and to maintain in within the normal range, CGM is much more advisable, beneficial when compared to lab sugar and glucometer sugar. So when there is no financial constraints, it is better to use CGMS. It will improve the quality of life. But there are studies which are comparable. Even some children are using SMBG, glucometer sugar monitoring, and CGMS. So some children, they are doing bad with CGM. Some children are doing best with glucometer sugar testing. So it should be individualized. So we can't 100% tell that CGMS is always superior. So some children it works better, some children it is detrimental. So simple glucometer works better for the some children. So your physician or caretaker will guide you better. Okay, yes, CGMS usage is safe using in children. Cell therapy is possible, sir, please tell about this. See, coming to the definitive treatment of the type 1 diabetes, so you need to understand the problem is beta cell destruction. Why there is a beta cell destruction? Unknown genetic environmental factors, they trigger antibodies to go and bind and destruct the beta cells. So how to have a cure? One thing is, in one way we have to stop killing of beta cells by antibodies. So we have to eradicate or limit or stop antibody production. And another thing is, we have to identify the genetic and environmental factors which will cause beta cells to die. So another way is, you have to prevent the beta cell stoppage, loss by genetic and environmental factors. And third is, if beta cells lost, they should be replaced. So cell therapy, here you're talking about the only lost cells. So lost beta cells will be replaced by stem cells. But the problem is to sustain the action of beta cells. Unless otherwise root cause of antibodies, genetic environmental factors are not minimized or controlled or prevented, even if cell therapy is given, ongoing beta cell loss will be there. So that is the biggest disadvantage, that is the biggest problem of managing curing type 1 diabetes. As of now, there are no positive studies which are telling that cell therapy is beneficial. In future, by understanding more about the diabetes background, nature of the disease progression, in future we may come better result with cell therapy. So there are studies, Oxford, Stanford, Cambridge University, they are doing vigorously in cell therapy, but till now animal studies and phase 2 trials are only there. There are no phase 3 and phase 4 trial which are telling that cell therapy is beneficial. So it is in pipeline. In future may be possible, but at this moment cell therapy is not possible. And at least for next 2 to 5 years, don't think about the cell therapy. And even majority of the parents are asking that, sir, my elder baby had type 1 diabetes, we had younger baby, for these baby we want to store stem cells. Can we store stem cells now, so that in future if cell therapy is available, can I use these stem cells? So to speak frankly, I don't have any idea whether the younger sibling stem cell will be used for the elder child or not, because there are another factors, HLA typing and grouping, matching should be there. So by just preserving stem cells may not be possible to cure the diabetes of elder individuals, maybe in future. But so if there are financial constraints, don't spend money on storing stem cells. This is sincere advice. It is possible in future. At this moment, cell therapy is not a definitive possible therapy for treating type 1 diabetes. Next question. Are there complications associated with untreated or poorly managed diabetes? Yes. See, diabetes is a way of living. It is not going to end at the day one. Your diabetes may be controlled now, but in future, if you are not monitored, if you are not treated properly, it will have irreversible complications. Earlier I said retinopathy, nephropathy, neuropathy, cardiomyopathy, immune dysfunction, DKA, death, poor wound healing leads to early amputation of the limbs. So the quality of life will come down, lifespan will come down. So if you are not treating type 1 diabetes, 100 out of 100, they do have associated irreversible complications. Yes, definitely there are complications. What should we do about the time zone change? Yeah, time zone change is, see, if you are moving to west and east, say for example, if you are moving to west, you need to take extra dose. And the better thing is, you keep your watch to the Indian time and you give Indian schedule, and you need to give extra extra dose. Whereas when you are moving to the east, you may skip evening dose, because time will be cut short. So 5 p.m. in the evening, if you are moving to the east, it will become maybe 1 p.m. or 2 p.m. Whereas if you are moving from 5 p.m. to the west zone, it may become like 10 p.m. or 11 p.m. So that's the reason it's better to carry Indian watch, which is denoting Indian time, so that you can use Indian time for 24 hours, and subsequently you will shift to the local time zone. Next. So can we do that while eating snacks? We can take insulin for 1 or 2 units. Ideally, yes, you need to take it. See, what is the purpose of eating is, so child is hungry. Okay, are you giving food to fill the stomach? No, right? We are not giving food to fill the stomach. We are giving food to provide energy for the child, so that by using energy, the activity will be maintained. So, to produce energy, insulin is a key. If you give insulin, key will be opened. Food digested, absorbed, and converted to energy. So, without giving insulin, giving snack is waste. So, but unfortunately, so in Indian setting where intermittent therapy as a standard of care, some children they eat constantly every 2 hour, 3 hourly. So we can't give them insulin every 2, 3 hourly. Okay, so if the gap between major meal and snack is less than 2 hours, no need of any insulin. If it is more than 2 hours, yes, definitely for every snack you need to cover up insulin. And another important point is, if the amount of snack is very small, 10 to 15% of your major meal like breakfast, lunch, or dinner, you may skip insulin. If the amount of snack is more than 10 or 15% of the breakfast, lunch, or dinner, say for example, child is eating 4 chapatis. Okay, one chapati will be 25%. If the child is eating only 25% of the half a chapati, that means 25%, definitely child may not take insulin. If the child is eating more than one chapati as a snack, definitely he need insulin. Okay, next. If the sugar level is normal, we can take insulin. Why you are taking insulin? Not only to bring abnormal sugar to the normal, at the same time you want to keep normal sugar to be normal in future also. The sugar may be normal now, maybe because of prior good diet, prior physical activity, prior insulin. But now you are eating, now you do physical activity, okay, and because of absence of insulin, in future sugar may go up. So, on taking the normal sugar, if you are not taking insulin, it is a detrimental. Even the sugar is normal, you need to take insulin. You are not supposed to miss or skip insulin. The only exception to skip or miss insulin is when the child sugar level is less than 50 or 70. In that condition only, insulin should be missed or skipped. Even the child is sick, vomiting, not taking, if the sugar is abnormal, you need to give insulin. So you can't skip insulin when the sugar is normal or elevated. Only sugar is low, then only insulin should be skipped or missed. Does being overweight causes diabetes? Overweight increases the risk of diabetes. So there is no 100% association of overweight and diabetes, but the individuals, the children who are overweight, they're more prone to have a diabetes. So if you're a normal child and overweight, normal child and overweight, so normal child 1 to 2% there is a diabetes risk, whereas overweight 5 to 10% they are more prone for diabetes. So by losing weight will protect the child not to develop diabetes. So it is beneficial. Keeping weight normal is beneficial for the individual to prevent and getting the diabetes. So overweight may aggravate the diabetes development. Can they have? Yes. Can they have plenty of fruits with less glycemic index? Yes, they can have it. But if they want to have plenty of fruits, so it's better to is mixed with insulin and major meal. So before giving a major meal, we will give a calculated insulin. Okay. So when the child want to eat plenty of fruits, if he consumed after major meal, the calculation of pre-insulin will be more. So you raise one or two more insulin, ask the child to eat major meal and then give plenty of fruits. If you want to give snacks as a fruit, then you have a limited number of fruits. Say if some children they eat 10 jamakayas, we call 10 gavas, or like 10 santras, 10 mozambis, 10 apples. One and a half, two will be okay, but more than that, so you are, even though low glycemic index, as a composite, the amount of glycemic index enter into the body will be more. So they need to cover up. So they need insulin. So limited fruits, no, not required. Plenty of fruits they can eat. If they want to eat, there should be a correction. Insulin correction should be there. Next, quinoa rice. Yes, they can take it. It is a low glycemic index. Black rice, red rice is also good, sir. Definitely, they are much better than white rice. Okay, they are not bad. So, but 100% I can't tell it is good. So, anything beyond the limit is bad. Even eating low glycemic index food, very enormous amount, may be bad for the child. Okay, like how a bad thing, even small quantity is dangerous for the body, even good thing, a big good thing is also dangerous for body. Say feel that to enjoy, to have a party, you want to eat biryani, so it will give a pleasure, but eating binge more amount of biryani is more harmful. If you eat limit, that is good, it will give pleasure, happy and everything. Like consuming alcohol, if it is a moderate amount, it is okay, but if you are consuming more enormous, it is detrimental. So similarly, black rice, red rice, they are not bad, they are okay, but we can't tell good, because depending on the amount, depending on the preparation. The important thing is, if the sugar is more, parboiled uncooked rice, half boiled rice will raise low sugar. If sugar is low, if the rice made is like overcooked and very polished, very smooth, soft rice, it will raise more sugar. So that is the reason you check the sugar, plan the sugar insulin, plan the diet preparation also, how to cook, what kind of food should be given. So it also should be taken into consideration before giving insulin. Okay, so they are okay, they are good in comparison to the white rice. Sugar fit and Fitterfly reverse method recommended for type 1 diabetes. I never experienced, and I don't want to blame anybody. So everybody is here to give education, awareness, and everything. So I don't want to go into business model. I don't want to tell they are bad or good. But one point is taken granted is type 1 at this moment is not reversible. There are no methods which will reverse type 1 diabetes. No herbal products, no insulin plants, no English medicines, no cell therapy, no immunotherapy, no latest insulin, no latest diet, no latest exercise, no latest thing will never reverse type 1 diabetes. Though there are no such thing which will reverse type 1 diabetes. Even bariatric surgery in type 1 diabetes also will not reverse type 1 diabetes. So I don't know about sugar fit and fitterfly, but there are no methods such which will reverse the type 1 diabetes. Please don't waste your money. They are not advisable and they are not recommended. So children's in future organ damaged. See, it is like a limping leg. You have to run marathon with a healthy legs or diseased legs. So on earth, you are here to do a marathon of life. If you are having good legs, you will do marathon very happily. If you have a bad legs or diseased legs with pain, you will do a marathon. So if the organs are damaged, they need to live, but they live with so much of pain, so much of health problems, so much of financial burden, economical burden, mental burden to the family and the child. So future will be very bad. So there are even type 1 diabetes or diabetes individuals with organ damage, organ transplant, they are not advisable. Even organ transplant societies, they will not they will consider type 1 diabetes as a exclusion for the transplantation. So even they are not fit for the transplantation also. So that is the reason keeping the organs healthy is must and essential. If you keep them well, so the future of your life and organs will be preserved and it will be normal. Next, if the child eats before testing, how to check the sugars? Yeah, that is a quite interesting and good question. So the thing is, ideally, sugar should be checked depending on the sugar level, depending on the amount of the diet, what he's going to consume, what we are going to give it. We need to calculate insulin. Then we will give insulin. After giving insulin 10-15 minutes, subsequently, we will tell the child to have meals, food. This is the ideal way. Sugar testing, insulin, food. Sometimes what happen because of child eating behavior, so we need to give insulin sometimes after food also. So to how to prevent it, how to tackle this issue is, make sure that food should not be reachable condition to the children. Don't give food as a reward. And whenever you want to give insulin time, like before breakfast, before lunch, before dinner, make sure that child should be in fasting at least 1.5 to 2 hours. Okay. And if by any chance child eat, at least wait for 1.5 to 2 hours, then check sugar, consider it as a fasting, and then depending on the sugar level you calculate the insulin and then give it. If you check the sugar after eating, definitely sugar will be elevated, and for the elevated sugar the calculated insulin will be elevated. You will give more insulin and you end up in postprandial hypoglycemia. So after eating child will have a low sugar. So if it is better to avoid it, if in case child ate, you wait for 1.5 to 2 hours, check sugar, and depending on the sugar take a decision. Next. So what happened when we skip insulin? See, insulin helps sugar to go into the cell. If we skip insulin, sugar is outside the cell only. So there is no fuel, there is no substrate for the energy production. So cell function will be hampered. Inside the cell, energy deficient. Outside the cell, more glucose. So inside the cell, as energy is deficient, cell function will be hampered. Outside the cell, glucose will be elevated. So because of the glucose elevated, glucose will be metabolized and become acid and ketones. So when you skip insulin, child had food, there is a chances of production of more ketones, more acid, more elevated sugar. So maybe in few hours, few days, nothing happened, but over a long period of time, added sugar, added ketone and acid will damage your organs. So if because of some unavoidable situation, if you skip or miss insulin, nothing happen, no need to worry at all. Whenever you remember, allow the child to eat. Before eating, give the insulin and then allow the child to eat. Okay, it's a better advice is not to skip insulin. It is like breathing, it is like drinking water. So eating is much important. So to consume energy, produce energy, you need insulin. It's better not to skip insulin. So what will happen, insulin if skipped, there will be side effects and complications because of the diabetes, acids and ketones. So at this moment, there are no proven studies which are stating that stem therapy reverses diabetes in children. In future, it may be, there are trials are going on. So there are different advances. Like scientists and doctors are like more looking into them. Are one thing is pancreatic transplantation, total organ transplant. Second thing is stem cell transplant. Third is immunotherapy, because there are antibodies which are killing pancreas, so immunotherapy. And fourth is gene therapy. Okay. And fifth is automatic artificial pancreas, whatever the insulin. So probably we are more advanced in human artificial pancreas, not natural pancreatic transplantation. So there are no proven studies. We don't know in future about pancreatic transplant, stem cells, gene therapy, and immunotherapy. Like in future, how it will be, but we need some more time and data to tell about the stem cells therapy effect. So at this moment, it will not reverse diabetes in children. In India, there are no centers which are doing stem cell therapy. In Western studies, in volunteer, few people are doing on research basis, study basis only. Okay, stem cells is not, it will not reverse diabetes in children. Okay, next. Yeah, so one important good question. I have type 1 diabetes. Are my children's at risk? See, normal individual, say for example, mother and father who are not having diabetes, they may get their son or daughter 1 to 2% of having type 1 diabetes. If one of the parent is diabetes, 5% there is a increased risk of diabetes in children. If one parent and one child is there, there is a risk of 15 to 20%. If two parents are affected with type 1 diabetes, there is a 15 to 25% chance of having type 1 diabetes. Compared to the normal children, definitely there is a increased risk of developing type 1 children, but the incidence rate is very low. Normal parents 1%, whereas a diseased one parent is 5% only. So don't worry. So type 1 children after becoming adult, yes, they can have a normal reproduction and recreation, they can marry and have children. But only sincere advice is, nowadays one type 1 bride will marry one type 1 groom. Like in thalassemia children, one thalassemia bride will marry one thalassemia groom. By marrying one type 1 children with another type 1 children, the incidence of type 1 children will be doubled and trebled. So it is better you, to marry normal individuals rather than marrying type 1 children. Yes, there is a increased risk, but it is a very minimal level only. So any economic affordable insulin pumps are available in India. See, insulin replacement, insulin administration is from by two methods: injection and pumps. Injection will give intermittent insulin, pump will give a continuous insulin. Even in injection, there are two things. One thing is syringe, second is pen. Coming to the pump, there are three varieties of pump: manual, semi automatic, near automatic pump. So, manual pumps are little bit affordable, economical. Pump maintenance is incomparable with intermittent insulin replacement. Say manual pump, it will be costing almost like 1.2 to 1.7 lakhs with maintenance of 4 to 6,000 per month. Whereas a near automatic pump, 6 to 8 lakhs with maintenance of 15,000 rupees per month. Okay, only available brand in India is Medtronics. Okay, there are no other pumps. So there are two types of pumps: wireless and wireless pumps. So we have India only wired pumps. What is better thing to eat in breakfast? So see, like better thing to eat in breakfast is low glycemic index, moderate carbohydrate, moderate protein, and low amount of fat and high fiber diet. Okay, so better is variable from individual to individual. So we may advise they can eat white idli, millet idli, normal dosha, plain dosha, onion dosha. Okay, like ragi java, millets, sprouts, nut rava, mota rava, wheat rava. Okay, so these are the millets. So these are the better options. They can have these kind of breakfast. Does the child develop resistance to insulin in course of time? Routinely, usually less likely, but 1 in 10,000 to 1 lakh individuals, they may develop resistance to insulin because of multiple factors. One factor is because of weight. If the child have excess weight, more weight, so insulin resistance will be developed because cells will become more resistant. Second thing is, sometimes insulin is a outside product, outside protein you are giving into the body, so your body will develop antibody to the insulin. So antibodies produced against the insulin will destruct the insulin, so insulin resistance will be developed. And third will be, by giving insulin, sometimes insulin clearance will be more. Especially these kind of thing happen in athletic activities. So in some athletes, because of doing more physical activity, metabolism is such a high that insulin will be dissolved or excreted very fast. Very very rare condition. One super athlete, it's a national level player with type 1 diabetes. So giving few amount of insulin, initially he require high dose of insulin. As he's getting into practice and doing physical activity, so his insulin requirement is very minimal. There are occasions where before meals they are skipping insulin also. So once or twice only the he is taking insulin. So another thing is, over physical activity also reduces the insulin amount, insulin required amount. So there are children, so they start doing physical activity, insulin requirement stop, and they are telling, and they are in arguing with me that my type 1 diabetes is reversed. Whenever we are checking insulin, c peptide level is low because of like strenuous physical activity. Whatever the sugar is there, that is they are getting utilized. For the time being, sugar is under control, but once exercise is minimized, weight gain put on, secondary sexual characters, hormones are developed, definitely they require more amount of insulin. So develop insulin resistance, but very minimal. So maybe 1 in 10,000 to 1 lakh they develop insulin resistance. How often child should seen as endocrinologist? So ideally at least 4 to 6 times in a year they should visit your endocrinologist or a diabetologist or pediatric endocrinologist. So at least once in 3 months, because HbA1c should be monitored and should be kept under less than 6.5 to 7%. And when the child is sick, when you are not able to achieve euglycemia, or when the child you feel that having associated other autoimmune problem or complication, you need to visit the doctor more frequently. Can children with diabetes participate in sports or physical activities? Yes, they can. They need to. That is the reason I'm telling. So type 1 diabetes children, sky should be only the limit. They should not limited in participating into the sports or physical activities because of presence of diabetes. So there are multiple sports persons like Wasim Akram, who is a sports person. He will take insulin. There are some table tennis. There are tennis players who are taking insulin. They are on insulin pump and playing sports. And there are Olympic players who are taking insulin and doing it. And even Nick Jonas, I don't want to name, I don't want to defame, but it is inspiring for younger people. That's the reason I want to name them. Okay, so they are doing normal activity. They do have type 1 diabetes, but replacing insulin, so they are able to do sports and physical activities. They should participate in sports and physical activities. They are encouraged. Unfortunately, fewer activities are minimized because of presence of diabetes. One thing is space activities, astronauts. So some super kids, 99% of the type 1 diabetes children are super kids and angels. Okay, they are having good knowledge. They are very good at academics. So unfortunately, few things like some defense, some astronaut sports, and some kind of contact sports like swimming in Olympics and bungee jumping in Olympics, skating in Olympics, they are limited, restricted. But majority of the sports like cricket, football, volleyball, basketball, these are the activities are not minimized and they don't have any limitation of participation because of presence of type 1 diabetes. We should encourage as a parent and healthcare provider to participate and to encourage our children to go and do physical activities. What are the latest advancement in diabetes technology? So the latest advancement is understanding of the diabetes by using CGMS sensor. So nowadays there are 14 days sensor, and in future upcoming there are 28 days, 1 month, 3 month long acting sensors. And rather than using blood, using urine and saliva for the sugar testing. So these are the sugar testing advancements. Whereas coming to the insulin advancement is automatic insulin pumps. So they are very latest and advanced. Omnipod 5, which is a wireless insulin pump. So even though it is not FDA approved in India, it is not available in India, but Western countries, the usage of wireless insulin pump has increased a lot, and so much of research is going on, non-invasive sugar testing, and so much of research is going on immunomodulatory therapy, cell therapy, transplant therapy. So at this moment, advances which are approved and applicable is sugar testing and insulin administration by using insulin pump and sensors. Sometimes sugar level goes below 50. Any effect of organ? So sugar is a energy substrate. If you have good energy, then only you are awake, aware, and able to perform physical activity. So to make you awake and aware, you need energy. So for the production of energy, glucose is a substrate. If sugar goes down, energy will goes down. So your awakeness, awareness, and performance may come down. So low sugar is more dangerous than high sugar. So when there is a low sugar, you may get dizziness, you may get blurring, diplopia, double vision. You may feel helplessness, sleeplessness, irritation, hunger, shivering, convulsion, fits, and child may go into coma. So some children will have a coma, seizures even at 50, 60. Some children may sustainable even the sugar at 40 to 30 also. So that's the reason, as per the SPAD guidelines, sugar should not go below less than 70. It is advisable to keep the sugar at least above 70. As per the SPAD guidelines, fasting sugar between 70 to 130 or 150. Postprandial sugar should be 90 to 180. This is the recommended sugar. It is advisable. Don't encourage or not, don't make your child to go sugar less than 50. 50 is more detrimental. It may provoke the child to go into seizures and coma. When to use ketone strips? When the child is sick, when the child have a active infection, when the consecutive sugar levels are more than 250. Okay, so at that point you need to check ketones. So there are easily available urine ketone strips, and even, yeah, coming to the recent advancement, even blood ketone checking machines are also available. So but they are quite expensive, almost to 15 to 20,000. The machine and strip cost is also 100 to 150 rupees. That is the reason routinely it is not advisable. But urine keto strips are much easily available, and they are very cheaper. When the child is sick, when the sugars are more than 250 to 300 consecutively not coming down, you need to check ketones. If it is +1 or +2, so you may continue insulin therapy. If it is more than +2, you need to consult local physician. Child may require admission and IV insulin therapy. So indication to check ketones is when the sugar is abnormal, infection, sick, child is not doing well. In that condition, you need to use ketone strips. So does changing insulin brand reduce the resistance to insulin? In fact, no. So changing brand will not change the resistance to insulin. Thank you. Thank you so much. So thank you so much. Thank you all my participants and my viewers. Hope if you like, so please share, subscribe and press like button. And your more liking and more subscription and more sharing make us to work and to give more talks like this, so that the diabetes awareness will be increased and endocrine related problem in children will be addressed appropriately and properly for the betterment of the society. So we are committed from my side and KIMS Cuddles team side. I would like to thank KIMS Cuddles team and digital team for organizing such a wonderful session. Thank you so much.